Incivility in Nursing by Ileana Diaz. Outline. What is incivility in nursing? Learning objectives. Course outcomes addressed. Nurse leader role in incivility. Effects on the patient. Culture of safety. Organizational meeting. Learning objectives. Current issue affecting the American healthcare system. Effects of incivility on the patient. How healthcare organizations are tackling incivility in nursing. Incivility or lateral violence in the workplace is disruptive behavior or communication that creates a negative work environment, thus interfering with quality patient care and safety. Incivility has an impact not only on the nurse, but also the patient and healthcare organization. Incivility is one or more rude, discourteous, or disrespectful actions that may or may not have a negative intent behind them. Behaviors included in incivility, or better known as bullying in the nursing workplace, include eye rolling, withholding information, backstabbing, and eyebrow raising, amongst other things. This is a video from the ANA about workplace bullying. Just click the link. Leadership and Management Course Outcome. Current issue affecting the American healthcare system. This topic is a very real-life problem that, unfortunately, is still happening. New research suggests that victims of nurse bullying are more likely to report that they intend to leave their job or quit nursing altogether. This tells you how bad the bullying is actually affecting the American healthcare system. These nurses worked so hard for their license just to give it all up. This behavior disrupts patient care and can cause unwanted variations and increased in cost care. Several surveys have found that most care providers have experienced or witnessed intimidating or disruptive Several surveys have found that most care providers have experienced or witnessed intimidating or disruptive behaviors. Unfortunately, I have witnessed incivility many times in nursing. The role of the nurse leader. The role of the nurse leader is to be there for support to all staff. This includes the person being bullied, the person who is being bullied, and the witnesses. They are role models for their colleagues. They provide information and educate to other care providers on their role as supportive coworkers and the negative effects of disruptive behavior on the patient quality of care and patient and staff safety. They team up with all disciplines across the organization to create professional behavior programs that have an extra focus to provide resources for staff. How does incivility impact our patients? The issue greatly affects our patients and the care that they receive. Nurses get burnt out and eventually leave their position. This leaves a gap, making it harder on other staff, and the patient does not receive the quality care that they deserve. It has been proven that there is an increase in medical errors when there is incivility within an organization. Additionally, mounting evidence suggests that poor communication and unprofessional relationships among healthcare providers have a direct impact on patients' outcomes and safety. These implications for patient safety have moved some regulatory and professional organizations to address the problem more assertively. For example, the Joint Commission issued a Centennial Alert and in 2010 implemented new standards that require healthcare organizations to have mechanisms in place to deal with uncivil and disrespectful behavior. A culture of safety. Many institutions today have adopted a culture of safety, where there is a zero-tolerance policy for incivility. It is important that nurses and other staff be held accountable for demonstrating positive behaviors. The Joint Commission has set new standards on the topic, including provide skills-based training and coaching for all leaders and managers in relationship building and collaborative practice, including skills for giving feedback on unprofessional behavior and conflict resolution. They also educate all team members, both physicians and non-physician staff, on appropriate professional behavior defined by the organization's code of conduct. Some incivility facts. According to Murray, lateral violence by nurses in the healthcare workplace is estimated to cost more than $4 billion each year because of lost time, productivity, and turnover of trained staff. A survey on intimidation conducted by the Institute for Safe Medication Practices found that 40% of clinicians have kept quiet or remained passive during patient care events rather than question a known intimidator. Healthcare organizations that ignore these behaviors also expose themselves to litigation from both employees and patients. Lateral violence undermines the requisite professional relationship needed for effective communication to ensure efficacious healthcare. My organizational meeting summary. I had the opportunity to attend one of the staff meetings at my current job. The one thing I really liked about this meeting was that the nurse manager came in with an agenda of things that needed to be discussed, and it was to the point and no sidetracking. Although I do wish that she had emailed us the agenda and so we could think about questions if we had any beforehand. I also liked that as part of her agenda, she talked about things that needed to be improved, what we have improved on, and what changes are being made. Hearing what improvements our facility has made, such as going from 12 falls to 1 fall, reinforces that we are doing something right. It gave me encouragement that we can change the things that need improvement. After taking one of the lessons in the IHI tutorial, Introduction to Healthcare Leadership, I was able to point out how to run a proper organizational meeting. Although the work meeting did not run as the tutorial says, I still think it was a constructive, and I was able to take away from it. These are my references. Thank you.